MSN Exam for Asthma Part 2. Question 1. Which is not a potential side effect of bronchodilator drugs? A. Tremor. B. Oral thrush. C. Tachycardia. D. Anxiety. E. Headache. Answer: B. Oral thrush. Question 2. What should you do when you have an asthma? A. Overuse asthma medication. B. Smoke. C. To use the medicines as prescribed. D. Not control diet. Answer: C. To use the medicines as prescribed. Question 3. In which age group of people is asthma the most common disease in? A. Children. B. Teens. C. Adults. D. Elderly. Answer: A. Children. Question 4. The following drug cannot cause asthma. A. Beta blocker. B. Histamine. C. Ibuprofen. D. Atropine. Answer: D. Atropine. Question 5. Which of the following respiratory condition is always considered a medical emergency? A. Laryngotracheobronchitis (LTB). B. Epiglottitis. C. Asthma. D. Cystic fibrosis. Answer: B. Epiglottitis. Acute and severe inflammation of the epiglottis can cause life-threatening airway obstruction, that is why it's always treated as a medical emergency. NSG intervention, prepared tracheostomy set at bedside. LTB, can also cause airway obstruction but it's not an emergency. Asthma is also not an emergency. CF is a chronic disease, so it's not a medical emergency. Question 6. The following bronchodilator is most commonly used when doing a reversibility test. A. Salbutamol. B. Adrenaline. C. Theophylline anhydrous. D. Atropine. Answer: A. Salbutamol. Question 7. A slightly obese female client with a history of allergy-induced asthma, hypertension, and mitral valve prolapse is admitted to an acute care facility for elective surgery. The nurse obtains a complete history and performs a thorough physical examination, paying special attention to the cardiovascular and respiratory systems. When percussing the client's chest wall, the nurse expects to elicit A. Resonant sounds. B. Hyperresonant sounds. C. Dull sounds. D. Flat sounds. Answer: A. Resonant sounds. When percussing the chest wall, the nurse expects to elicit resonant sounds, low-pitched, hollow sounds heard over normal lung tissue. Hyperresonant sounds indicate increased air in the lungs or pleural space. They're louder and lower pitched than resonant sounds. Although hyperresonant sounds occur in such disorders as emphysema and pneumothorax, they may be normal in children and very thin adults. Dull sounds, normally heard only over the liver and heart, may occur over dense lung tissue, such as from consolidation or a tumor. Dull sounds are thud-like and of meaty pitch. Flat sounds, soft and high-pitched, are heard over airless tissue and can be replicated by percussing the thigh or a bony structure. Question 8. Which contraindication should the nurse assess for prior to giving a child immunization? A. Mild cold symptoms. B. Chronic asthma. C. Depressed immune system. D. Allergy to eggs. Answer: C. Depressed immune system. Children who have a depressed immune system related to HIV or chemotherapy should not be given routine immunizations. Question 9. Common signs and symptoms include excessive coughing, wheezing chest, tightness, shortness of breath, waking at night. A. True. B. False. Answer: A. True. Question 10. Asthma is basically A. An infectious disease. B. An autoimmune disease. C. An atopic disease. D. A malignant disease. Answer: C. An atopic disease. Question 11. Use your air conditioner to help filter the air coming into the center. A. True. B. False. Answer: A. True. Question 12. What is asthma? A. Heart failure. B. A mild ailment. C. An intestinal illness. D. A chronic respiratory disease. Answer: D. A chronic respiratory disease. Question 13. Cockroaches can trigger asthma attacks. A. True. B. False. Answer: A. True. Question 14. Dust and dust mites can trigger asthma too. What are ways to reduce the chances? A. Keep classrooms as clean and clutter-free as possible. B. Dust furniture regularly with a damp cloth and allow sufficient time to dry. C. Wash pillows, blankets and stuffed toys often. D. All of the above. Answer: D. All of the above. Question 15. Inhaled steroids preventer, controller will cause major side effects at recommended dosages. A. True. B. False. Answer: B. False. Question 16. Which of the following is not considered a cough-related disease? A. Bronchiectasis. B. Bronchial asthma. C. Bronchitis. D. Bronchial hypotension. Answer: D. Bronchial hypotension. Question 17. A 19-year-old patient comes to the ED with acute asthma. His respiratory rate is 44 breaths a minute, and he appears to be in acute respiratory distress. Which of the following actions should you take first? A. Take a full medical history. B. Give a bronchodilator by nebulizer. C. Apply a cardiac monitor to the patient. D. Provide emotional support for the patient. Answer: B. Give a bronchodilator by nebulizer. The patient having an acute asthma attack needs more oxygen delivered to his lungs and body. Nebulized bronchodilators open airways and increase the amount of oxygen delivered. The patient may not need cardiac monitoring because he's only 19 years old, unless he has a medical history of cardiac problems. Question 18. Which answer is a true symptom of asthma? A. Emotional problems. B. Clogging the mucus blocks the airways and thus allows less air to pass through the airways. C. Swelling of the airways. D. B and C are correct. Answer: D. B and C are correct. Question 19. The parameter to detect reversibility in airflow obstruction on a spirometry test is A. FEV1. B. FVC. C. MVV. D. RV. Answer: A. FEV1. Question 20. In those with asthma, which of the following does not contribute to inspiratory muscle weakness? A. Increased use of steroid-based medication. B. Dyspnea. C. Reduced exercise tolerance. D. Inflammatory processes. Answer: B. Dyspnea. Question 21. True/false. Gastroesophageal reflux should be considered in a patient who has poorly controlled asthma, with a significant nocturnal component. A. True. B. False. Answer: A. True. A significant correlation between nocturnal asthma and gastroesophageal reflux has been observed. The patient may not complain of epigastric burning or have reflux symptoms. Cough may be the only symptom. Question 22. I cannot participate in physical activities if I have asthma. A. True. B. False. Answer: B. False. Question 23. Which of the following statements by the family of a child with asthma indicates a need for additional teaching? A. We need to identify what things triggers his attacks. B. He is to use bronchodilator inhaler before steroid inhaler. C. We'll make sure he avoids exercise to prevent asthma attacks. D. He should increase his fluid intake regularly to thin secretions. Answer: C. We'll make sure he avoids exercise to prevent asthma attacks. Asthmatic children don't have to avoid exercise. They can participate on physical activities as tolerated. Using a bronchodilator before administering steroids is correct because steroids are just anti-inflammatory and they don't have effects on the dilation of the bronchioles. Of course, letters A and B are obviously correct. Question 24. The following are helpful in determining the severity of an acute attack except A. Use of exercise muscles of respiration. B. Ability to complete sentences. C. Peak expiratory flow rate. D. Pedal edema. Answer: D. Pedal edema. Question 25. A good inhalation technique can ensure that the medication is delivered to the airways of the lungs. A. True. B. False. Answer: A. True. Question 26. Symptoms of asthma include wheezing, coughing and breathing difficulty. A. True. B. False. Answer: A. True. Question 27. A white female client is admitted to an acute care facility with a diagnosis of cerebrovascular accident (CVA). Her history reveals bronchial asthma, exogenous obesity, and iron deficiency anemia. Which history finding is a risk factor for CVA? A. Caucasian race. B. Female sex. C. Obesity. D. Bronchial asthma. Answer: C. Obesity. Obesity is a risk factor for CVA. Other risk factors include a history of ischemic episodes, cardiovascular disease, diabetes mellitus, atherosclerosis of the cranial vessels, hypertension, polycythemia, smoking, hypercholesterolemia, oral contraceptive use, emotional stress, family history of CVA, and advancing age. The client's race, sex, and bronchial asthma aren't risk factors for CVA. Question 28. Asthma is triggered by allergens such as pollen and animal furs. A. True. B. False. Answer: A. True. Question 29. Carol Smith is using bronchodilators for asthma. The side effects of these drugs that you need to monitor this patient for include: A. Tachycardia, nausea, vomiting, heart palpitations, inability to sleep, restlessness, and seizures. B. Tachycardia, headache, dyspnea, temp. 101F, and wheezing. C. Blurred vision, tachycardia, hypertension, headache, insomnia, and oliguria. D. Restlessness, insomnia, blurred vision, hypertension, chest pain, and muscle weakness. Answer: A. Tachycardia, nausea, vomiting, heart palpitations, inability to sleep, restlessness, and seizures. Bronchodilators can produce the side effects listed in answer choice for a short time after the patient begins using them. Question 30. What of these is not a characteristic of allergic asthma? A. Starts in childhood or adolescence. B. Triggered by specific allergens E, dust mites and pollen. C. Presence with bronchoconstriction and inflammation of the airways. D. Is a consequence of viral infection. Answer: D. Is a consequence of viral infection. Question 31. Bronchoprovocation tests usually use histamine to challenge the airways. Besides histamine, underscore can also be used. A. Ipratropium bromide. B. Adrenocorticotropic hormone. C. prednisolone. D. Metaricaline. Answer: D. Metaricaline. Question 32. Lisa is newly diagnosed with asthma and is being discharged from the hospital after an episode of status asthmaticus. Discharge teaching should include which of the following? A. Limitations in sports that will be imposed by the illness. B. Specific instructions on staying calm during an attack. C. The relationship of symptoms and a specific trigger such as physical exercise. D. Incidence of status asthmaticus in children and teens. Answer: C. The relationship of symptoms and a specific trigger such as physical exercise. COPD clients have low oxygen and high carbon dioxide levels. Therefore, hypoxia is the main stimulus for ventilation as persons with chronic hypercapnia. Increasing the level of oxygen would decrease the stimulus to breathe. Question 33. True/false. If a patient has had coughing or wheezing for over 1 year, the possibility of a foreign body is essentially ruled out. A. True. B. False. Answer: B. False. The acute cough or wheeze caused by a foreign body in the lower respiratory tract may diminish over time only to recur later and present as chronic cough or persistent wheezing. Question 34. Which of the following is not a risk factor for the development of asthma? A. Parental history of asthma. B. Physician-diagnosed atopic dermatitis. C. Peripheral eosinophilia and allergic rhinitis. D. Wheezing apart from colds and allergic rhinitis. E. Recurrent otitis media. Answer: E. Recurrent otitis media. Question 35. The nurse understands that a good snack for a 2-year-old with a diagnosis of acute asthma would be A. Grapes. B. Apple slices. C. A glass of milk. D. A glass of cola. Answer: B. Apple slices. Grapes is inappropriate because of its skin that can cause choking. A glass of milk is not a good snack because it's the most common cause of iron deficiency anemia in children. Milk contains few iron. A glass of cola is also not appropriate cause it contains complex sugar. Question 36. Asthma is caused by inflammation of the airways and the lungs. A. True. B. False. Answer: A. True. Question 37. What can lead to an asthma attack? A. Airway obstruction. B. Airway irritability. C. Inflammation. D. All of the above. Answer: D. All of the above. Question 38. Which of the following is true? A. A preventer is used to relieve asthma attacks. B. A reliever is used to relieve asthma attacks. Answer: B. A reliever is used to relieve asthma attacks. Question 39. Crying, laughing hard or yelling can trigger asthma. A. True. B. False. Answer: A. True. Question 40. Evidence suggests there are 3 crucial factors in the primary prevention of asthma. These include: A. Avoidance of household pets, obesity and allergen avoidance. B. Exposure to environmental tobacco smoke, breastfeeding during infancy and allergen avoidance. C. Drug therapy with associated disease, avoidance of sedentary behavior and exposure to environmental tobacco smoke. D. Breastfeeding during infancy, residing at least 20 kilometers outside a major city and gaining at least 3 hours of oxygen from outdoors per day. Answer: B. Exposure to environmental tobacco smoke, breastfeeding during infancy and allergen avoidance. Question 41. Mark, a 7-year-old client, is brought to the emergency department. He's tachypneic and febrile and has a respiratory rate of 36 breaths a minute and has a non-productive cough. He recently had a cold. From this history, the client may have which of the following conditions? A. Acute asthma. B. Bronchial pneumonia. C. Chronic obstructive pulmonary disease (COPD). D. Emphysema. Answer: A. Acute asthma. Based on the client's history and symptoms, acute asthma is the most likely diagnosis. He's unlikely to have bronchial pneumonia without a productive cough and fever, and he's too young to have developed COPD and emphysema. Question 42. Which is not a hallmark feature of asthma? A. Edema. B. Dynamic airway collapse. C. Bronchospasm. D. Epithelial damage. Answer: B. Dynamic airway collapse. Question 43. Kennedy with acute asthma showing inspiratory and expiratory wheezes and a decreased forced expiratory volume should be treated with which of the following classes of medication right away? A. Beta-adrenergic blockers. B. Bronchodilators. C. Inhaled steroids. D. Oral steroids. Answer: B. Bronchodilators. Bronchodilators are the first line of treatment for asthma because bronchoconstriction is the cause of reduced airflow. Beta-adrenergic blockers aren't used to treat asthma and can cause bronchoconstriction. Inhaled oral steroids may be given to reduce the inflammation but aren't used for emergency relief. Question 44. When does nocturnal asthma usually occur? A. Early night. B. Near dawn. C. 2 am 4 am in the middle of the night. D. It does not exist. Answer: C. 2 am 4 am in the middle of the night. Question 45. Perfumes and cleaning products can be an asthma trigger. A. True. B. False. Answer: A. True. Try not to wear perfumes to school. Limit the use of scented aerosols in the center. Try to use non-aerosol cleaners while asthmatic children are present. Question 46. All classroom pets should be banned to prevent asthma triggers. A. True. B. False. Answer: B. False. Proteins in animals' skin flakes, urine, feces, saliva and hair can trigger asthma. Dogs, cats, rodents including hamsters and guinea pigs and other warm-blooded mammals can trigger asthma in individuals with an allergy to animal dander. So, load your class with the asthma-friendliest pets of all, fish. Question 47. Staff who smoke on their personal time cannot harm children with asthma. A. True. B. False. Answer: B. False. Secondhand smoke can be present on your clothing, therefore exposing children to it. Never smoke in clothing you wear to work. Question 48. A child has been brought to the emergency room with an asthma attack. What signs and symptoms would the nurse expect to see? A. A prolonged inspiratory time and a short expiratory time. B. Frequent productive coughing of clear, frothy, thin mucus progressing to thick, tenacious mucus heard only on auscultation. C. Hypoinflation of the alveoli with resulting poor gas exchange from increasingly shallow inspirations. D. Swelling of the bronchial mucosa, with wheezes starting on expiration and spreading to continuous. Answer: D. Swelling of the bronchial mucosa, with wheezes starting on expiration and spreading to continuous. Bronchi normally expand and lengthen during inspiration and shorten during expiration. Asthma causes spasm of the smooth muscles in the bronchi and bronchioles, resulting in an even tighter airway on exhalation and prolonged exhalation. Inspirations increase in rate in an effort to relieve hypoxia. At the beginning of the attack, the cough is non-productive and results from bronchial edema. Then the mucus becomes profuse and rattly, with a cough producing frothy, clear sputum. Gas trapping is the central feature of asthma. It is caused by allowing more air to enter alveoli than can escape from them through the narrowed airways. Gas trapping also causes an increased depth and rate of respirations. The wheeze starts during the expiratory phase because of the extreme narrowing of the bronchus on exhalation. As obstruction increases, wheezes become more high-pitched and continuous. Question 49. Asthma has the greatest prevalence in which two populations? A. Males aged 25-44 years and females 10-14 years. B. Males aged 15-19 years and females aged 10-14 years. C. Males aged 10-14 years and females aged 20-24 years. D. Males aged 20-24 years and females aged 25-44 years. Answer: C. Males aged 10-14 years and females aged 20-24 years. Question 50. What are the two categories of pharmacological agents used in the treatment of asthma? A. B2 adrenoreceptor antagonists and bronchodilators. B. Anti-inflammatory and glucocorticoids. C. Inhaled medications and oral medications. D. Bronchodilators and anti-inflammatory. Answer: D. Bronchodilators and anti-inflammatory. Question 51. There is no single cause for asthma and currently, there is no cure for asthma. A. True. B. False. Answer: A. True. Question 52. Which answer best describes common outdoor asthma triggers? A. Changes in weather and temperature. B. Pollen. C. Air pollution. D. All of the above. Answer: D. All of the above. Question 53. A 5-year-old male comes in with a history of asthma, but currently is not on any medication. In the history, you find out he uses his albuterol MDI with spacer once every 2 weeks during the day. He does wake up 2-3 times per week, coughing at night. How would you classify his asthma? A. Intermittent. B. Mild persistent. C. Moderate persistent. D. Severe persistent. Answer: C. Moderate persistent. Moderate persistent, greater than 1 night per week of symptoms bumps him to moderate persistent. Question 54. Which finding would alert a nurse that a hospitalized 6-year-old child is at risk for a severe asthma exacerbation? A. Oxygen saturation of 95%. B. Mild work of breathing. C. Absence of intercostals or substernal retractions. D. History of steroid-dependent asthma. Answer: D. History of steroid-dependent asthma. A history of steroid-dependent asthma, a contributing factor to this client's high-risk status, requires the nurse to treat the situation as a severe exacerbation regardless of the severity of the current episode. An oxygen saturation of 95%, mild work of breathing, and absence of intercostals or substernal retractions are all normal findings. Question 55. The characteristic feature of persistent asthma is: A. Family history of disease. B. Airway inflammation. C. Need for oral steroids. D. Nocturnal wheezing. Answer: B. Airway inflammation. Question 56. Which statement is true about asthma? A. Asthma is one of the most common chronic diseases nationwide, impacting the lives and families of over 7 million children. B. Asthma is the third-ranking cause of hospitalization among children under 15. C. An average of 1 of every 10 school-aged children has asthma and 10.5 million school days are missed each year due to asthmas. D. All of the above is true. Answer: D. All of the above is true. Question 57. The primary physiological alteration in the development of asthma is: A. Bronchiolar inflammation and dyspnea. B. Hypersecretion of abnormally viscous mucus. C. Infectious processes causing mucosal edema. D. Spasm of bronchiolar smooth muscle. Answer: D. Spasm of bronchiolar smooth muscle. Asthma is the presence of bronchiolar spasms. This spasm can be brought on by allergies or anxiety. Answer A is incorrect because the primary physiological alteration is not inflammation. Answer B is incorrect because there's the production of abnormally viscous mucus, not a primary alteration. Answer C is incorrect because infection is not primary to asthma. Question 58. A black client with asthma seeks emergency care for acute respiratory distress. Because of this client's dark skin, the nurse should assess for cyanosis by inspecting the A. Lips. B. Mucous membranes. C. Nail beds. D. Earlobes. Answer B. Mucous membranes. Skin color doesn't affect the mucous membranes. The lips, nail beds, and earlobes are less reliable indicators of cyanosis because they're affected by skin color. Question 59. A client with asthma has low-pitched wheezes present on the final half of exhalation. 1 hour later the client has high-pitched wheezes extending throughout exhalation. This change in assessment indicates to the nurse that the client A. has increased airway obstruction, B. has improved airway obstruction, C. needs to be suctioned, D. exhibits hyperventilation. Answer A. has increased airway obstruction. The higher pitched the sound is, the more narrow the airway. Therefore, the obstruction has increased or worsened. With no evidence of secretions, no support exists to indicate the need for suctioning. Question 60. Simple instrument to roughly determine lung function is A. Barometer, B. manometer, C. peak flow meter, D. sphygmomanometer. Answer C. peak flow meter. Question 61. The nurse is caring for Kenneth experiencing an acute asthma attack. The client stops wheezing and breath sounds aren't audible. The reason for this change is that A. the attack is over, B. the airways are so swollen that no air cannot get through, C. the swelling has decreased, D. crackles have replaced wheezes. Answer B. The airways are so swollen that no air cannot get through. During an acute attack, wheezing may stop and breath sounds become inaudible because the airways are so swollen that air can't get through. If the attack is over and swelling has decreased, there would be no more wheezing and less emergent concern. Crackles do not replace wheezes during an acute asthma attack. Question 62. How can seasonal asthma come about? A. Inhalation or exposure to trees, grasses or flowers releasing pollen into the air. B. Inhalation of tobacco smoke. C. Exposure to paint thinners or dust. Answer A. Inhalation or exposure to trees, grasses or flowers releasing pollen into the air. Question 63. The key role of a physiotherapist in treatment of asthma is to A. Provide education to the patient about the disease and treatment options. B. Administering and educating the patient about airway clearance techniques. C. Provide education about exercise and the option of pulmonary rehabilitation classes. D. All of the above. E. None of the above. Answer D. All of the above. Question 64. Asthma is A. Localized, irreversible dilation of part of the bronchial tree due to destruction of the muscle and elastic tissue. B. A persistent cough that produces sputum and mucus for at least 3 months of the year, 2 years in succession. C. A chronic inflammatory disorder of the airways associated with episodes of wheezing, breathlessness, chest tightness and coughing. D. Collapse and closure of alveoli resulting in reduced or absent gas exchange affecting all of part of the lung. Answer: C. A chronic inflammatory disorder of the airways associated with episodes of wheezing, breathlessness, chest tightness and coughing. Question 65. Which of the following tests cannot detect airway inflammation? A. Bronchial mucosal biopsy. B. Sputum eosinophil counts. C. Bronchoalveolar lavage. D. Spirometry. Answer: D. Spirometry. Question 66. Asthma can be life-threatening. A. True. B. False. Answer: A. True. Question 67. Asthma causes the airways to A. Constrict. B. Become inflamed. C. Become lined with a large amount of mucus. D. All of the above. Answer: D. All of the above. Question 68. In an acute severe attack of asthma, it is important to get a chest X-ray done to rule out A. A pleural effusion. B. A pneumothorax. C. Lung malignancy. D. COPT. Answer: B. A pneumothorax. Question 69. If a person suffers from asthma, what are the likely symptoms he or she may have? A. Sore, swollen and sensitive airway linings. B. Weak breathing. C. Fast and unsteady pulse. D. Cancer in the airway. Answer: A. Sore, swollen and sensitive airway linings. Question 70. An 8-year-old boy with asthma is brought to the clinic for checkup. The mother asks the nurse if the treatment given to her son is effective. What would be the appropriate response of the nurse? A. I will review first the child's height on a growth chart to know if the treatment is working. B. I will review first the child's weight on a growth chart to know if the treatment is working. C. I will review first the number of prescriptions or refills the child has required over the last 6 months to give you an accurate answer. D. I will review first the number of times the child has seen the pediatrician during the last 6 months to give you an accurate answer. Answer: C. I will review first the number of prescriptions or refills the child has required over the last 6 months to give you an accurate answer. Reviewing the number of prescription refills the child has required over the last 6 months would be the best indicator of how well controlled and thus how effective the child's asthma treatment is. Breakthrough wheezing, shortness of breath, and upper respiratory infections would require that the child take additional medication. This would be reflected in the number of prescription refills.
Thanks for watching. Please comment, like and share.